Dr. Nolan is a pediatrician, bioethicist, and president of Physicians for Social Responsibility of New York. She's the co-founder of Concerned Health Professionals of New York and an Ulster County legislator. She said exposure to even very low levels of radiation is more dangerous than previously estimated, especially for women, children, and during prenatal life. Thank you, Dr. Nolan, for joining us today and really helping us to understand the risks we are facing here around Indian Point. Thank you.
Thank you. Appreciate your introduction and the introduction of County Executive Latimer. I wanted to note that Megan Gander from U.S. Senator Chuck Schumer's office also noted in the chat that she's present here today, so appreciate that. And I really appreciate the opportunity to talk about potential health impacts and how we evaluate them and think about them, especially in relationship to this decommissioning effort. Health assessment sounds like something that could be very simple. Is it going to be harmful or is it not? However, in order to know the answers to those kinds of questions, we need to look deeper. So the assessment of what the impacts will be on human health of a particular action need to address what toxins, what concentrations or doses, what routes of exposure, what populations, and in what condition would a person who might be receiving such an exposure be in. The way that many regulatory agencies view these kinds of questions is to look at standard guidelines and reference values for whether or not a particular exposure would be problematic. But those standard guidelines and reference values really are derived from analysis of average, often just white adult males. So those kinds of reference values can give us an initial starting point for analyzing what impacts may be, but they don't tell the whole story. Children and embryos and fetuses during prenatal development, and women and elderly populations and people with pre-existing conditions have unique susceptibilities, and they often require, but do not often receive, extra protection. I want to talk about the radioactivity that we are concerned about in relationship to other kinds of toxins or contaminants that may be present in our environment and cause harm, because I think it gives us a sense of the specific problems related to these specific agents. So toxins or contaminants can be considered in 5 main categories. They can be infectious, like the flu. They can be caustic, like a burn or blunt trauma. They can be mutagenic, which means that they cause abnormalities or changes in DNA or RNA in cells. They can be cancerogenic, or carcinogenic, which means that they cause cancers, sometimes by causing those changes in the DNA or RNA, but sometimes through other mechanisms. And they can be what's called teratogenic, which means causing an abnormal growth. Radioactive agents are caustic, mutagenic, cancerous, and teratogenic agents. In terms of being cancerous agents, that's particularly problematic for young children because young children are growing rapidly, and growth requires precise cell-to-cell communication for proper development, particularly of the nervous system. Children frequently also receive greater exposure, basically higher doses of toxins that are in air, water, and soil, because children are breathing quickly and they have greater contact with dust and soil because they don't wash their hands as frequently, and often their hands go into their mouths. So there are routes of exposure that are particular to children that we don't see in adults. Embryos and fetuses are uniquely susceptible to the harmful effects from teratogenic agents. Cells during early intrauterine life are dividing and changing at extraordinary rates. and even tiny doses of agents that can disrupt DNA, RNA, or cell-to-cell communication can pose disastrous consequences. It's really a miracle when development proceeds normally and a child is born that has 10 fingers and toes, and all organs are properly aligned and functioning. Even tiny disruptions early in life can mean major consequences. Harmful agents can pass through the placenta to the embryo or fetus, and sometimes are even concentrated there. So every aspect of early development, being an integrated choreography of cell specialization and growth, can be upset, and normal development can be prevented by what to adults might be minor disrupting influences. So radioactive agents are not minor disrupting influences. Even at tiny doses, they can have major impacts. And they pose specific threats to children and to embryos and fetuses, and as we'll hear, to other vulnerable populations. These effects have not been fully studied. So when we are trying to determine what is a good course of action to take, what we ought to do as moral agents, we need to have information to guide those decisions. And much of that information is not available, especially for these vulnerable populations and for cumulative impacts. For example, for children who are at a schoolyard that might be repeatedly exposed, and families that might be taking in water that they're drinking in and bathing in and showering in. So there are ways to evaluate these impacts. A formal, comprehensive health impact assessment would lay out all the factors and require gathering of information and data on every element that I've been discussing and more. And that's really what should be done before any potentially harmful action would be taken. If that kind of study is not contemplated, then we should operate under the precautionary principle. If we don't know enough to know that it's safe, it's harmful, and we should consider it harmful and not do it. And I would just say, in relationship to the adage, dilution is the solution to pollution, that if the dilution is the solution, it is pollution. So I'll stop there in the interest of time and hope that we're able to come to questions that people may have.
Thank you, Dr. Nolan. You really succinctly shared all that information. There are several questions about what you were talking about. One from a parent: how do we know that the past, current, and future levels of radiation at the elementary school were or are safe? How often should that be tested? And as a precaution, and because the NRC takes 3 years to report a leak, can children at the school be administered potassium iodine regularly to help minimize their chances of developing cancer in their teens or 20s? So I guess questions specifically about the kids, especially, I'm sure my stomach was churning as Mr. Gunderson was talking about the evaporation and the rain out, because both my kids went to Buchanan Verplank Elementary while Indian Point was operational. So can you say a little bit about what we should be concerned about in terms of the school children and exposure?
Well, I would actually ask Arnie Gunderson to help me with that question, because I think his expertise would be called for in terms of the exposures that they have. And then we would go from that to talking about whether any treatment would be necessary.
The potassium iodide only works on iodine releases, and they have an 8-day half-life. So within 90 days, they're gone. With the plant shut down, as long as it is, there'll be no iodine and no need to take a potassium iodide pill. In addition, KI has some adverse health effects, so you shouldn't just pop them for the heck of it.
Thank you. And then one other question was, let me try and summarize. It was a long question. basically, I think the person was asking, saying we have studies that the PCBs in the Hudson are measurable and harmful to the public, but we know nothing about the harmful effects of the proposed releases. So I think asking, so we know about PCBs, like EPA is involved, they're measuring, they're doing studies, tracking health data. Has that been done by any federal oversight agency?
I don't know that it has been done. I don't think that it has been done in relation to radioactive materials. In regard to PCBs, that is relatively new information, that PCBs are volatilized into the air and affecting the health of people who live along the Hudson River. That was very important research done by Dr. David Carpenter and others. And it makes me very concerned about this dumping of radioactive material into water, because it means that there might be a potential exposure route via volatilization into the air, in addition to being exposed through drinking water or coming in contact with the water.